Complementary therapies are meant to complement your cancer treatments and to help you enjoy a better quality of life. I would like to now introduce you to Dr. Caitlyn Keates and Meredith Gowling to share information about complementary therapies and how they can support you along your cancer pathway. Dr. Keates is a graduate from the Canadian College of Naturopathic Medicine and current practitioner at the Centre for Health Innovation in Ottawa. Her clinical practice focuses on integrative oncology and women's health and fertility. Additionally, Dr. Keates is a research assistant with the Patterson Institute of Integrative Oncology Research and holds additional licensing in IV therapy and prescription authority. And Meredith, welcome Meredith, was diagnosed with stage 4B high-grade serous ovarian cancer back in August of 2021. Since then, through various treatments and surgical procedures, her focus has been to maintain her quality of life. And in her words, so far it's worked out pretty well. She commutes to Ottawa for all of her cancer treatments, and then it's home to Merrickville, where she is most relaxed. Spontaneous get-togethers with her friends are the norm, and she loves the chaos of family gatherings at her house, and the more the merrier. She kayaks along the river a block away from her home and has yet to run out of new hiking trails to explore. So welcome, Dr. Keates and Meredith. And Dr. Keates, I'm going to turn it over to you.
Wonderful. Thank you, Stephanie. And thank you so much for having me again. This is my actual second time presenting with Ovarian Cancer Canada. And it's been an absolute honor to be invited back and to host this session today with my patient that I've been have the pleasure to watch go through the entire journey that she's gone through from diagnoses to where she is now. And it's so awesome to be able to join this session with you today to have a patient perspective alongside a bit of a practitioner's journey as well. So a little bit about myself. Actually, I have a PowerPoint. So it's from the previous presentation. We've ramped it up a little bit, but it's also a good resource for whoever needs to use it following this presentation to kind of cite back to. And so I'm just going to share my screen first here. Meredith, do you want to take the moment while I do that to kind of introduce yourself? And I think that's what we're going to start with today anyways.
Sure. Hello, everybody. Thank you so much for taking part in this symposium. This is a subject I'm just super excited about. When I made the decision to do all the conventional cancer treatments, the chemotherapy, the surgery, more chemotherapy, it was because I wanted to live longer. But when I decided to incorporate science-backed complementary cancer treatments, it was because I also wanted to live well. It was then and is now all about my quality of life. So here I am, more than 2 years into this journey, still healthy and still living well. And it's not because I haven't had my medical ups and downs. I have had my share. Actually, I recently spent a week in the hospital with a very not fun small bowel obstruction. I just, at least so far, seem able to weather stuff a little bit, quite well. Conventional treatment-wise, ovarian cancer doesn't have a lot of tools. My family and I found that out early on. So we did a lot of research, talked to medical professionals, from both sides, conventional and complementary, and realized for me, the best plan would involve both conventional and complementary. And I will let Dr. Keates take it from here now.
Perfect. All righty. So I shared this with Meredith already. Oops. I'm going to go here. I'm going to whiz through this super fast because I know that the Q&A last year was probably the most popular of the session, but a little bit about me. I'm a naturopathic doctor. I chose naturopathic medicine after I've been a Canadian national team gymnast for majority of my life. So natural therapies was always prevalent for me. When I did my undergrad on the East Coast. I went to Nova Scotia to St. Francis Xavier and did a kinesiology and a medical science, like pre-med background with the intentions of going to medical school. But at the time when I was doing all my volunteer work and everything like that, writing my MCAT, I had my grandmother got diagnosed with lung cancer, and she had a little bit of a palliative case here where there was not much treatment option for her. And that's when we explored naturopathic therapies and medicine. And that's where my interest kind of peaked. And I thought the groundwork of all of that kind of resembled who I was as a person a little bit more than the conventional based system. So I started to explore that area and kind of just blossomed from there. I practice at the Center for Health Innovation. So it's formerly was called the Ottawa Integrative Cancer Center. And I primarily focus there on integrative oncology and see patients like Meredith there to support them throughout their cancer journey. And then I'm also part of a few associations here, the ONC-AMP, the OAND, the CAND, and I'm registered with CONO, so that's a regulatory body here in the province of Ontario. So I can see patients in Ontario or unregulated provinces and states as well. But yeah, I have a virtual based practice, so I see a lot of patients that way. And a little bit about what naturopathic medicine is as well. So I'm sure you've all probably been a bit curious to it or look this up yourself, but we're just more concentrated on finding more natural ways for the body to heal. We don't use conventional based therapies within our practice. We primarily prioritize the more natural, least invasive, least toxic therapies to treat the illness itself and allow the body to kind of use its innate wisdom, like it says there, to heal and provide wellness that way. We treat with these naturopathic principles in mind. So first, do no harm, doctor as a teacher, the healing power of nature, treating the whole person, identifying and treating the cause. And then we do a lot of preventative medicine as well. So when we go through an intake and through a treatment plan, this is kind of what we're keeping in mind. And we also have the gift of time. So a lot of my patients, especially in integrative oncology, will discuss their conventional based treatment options and learn about what they're being prescribed. So we're well versed not only in kind of your natural based approaches, but also your conventional based approaches too. This is what a visit typically will look like. Meredith, we went through quite a few follow-up visits from this time frame here, but like I said, with an integrative oncology visit, it's about an hour and a half in length. We discuss kind of your goals of your visit. In oncology, we are dealing more so, it's not an alternative therapy in any shape or form. We're really focusing on integrative management here. So I'm really narrowing in on what we're doing conventionally, what the diagnosis is, what the treatment is, what your oncologist is presenting to you. We'll talk a lot about dietary and lifestyle interventions that we can introduce, because obviously a lot of those don't have any interactions within your conventional based treatment, or if there are, we'll discuss what those might be. And then we'll start to consider some natural health products and medications that we might implement as well that will complement your therapy or help prevent some of your side effects from happening. During that time, we also go through not just your diagnosis, we'll talk about perhaps other things that might be going on that are completely unrelated to your actual ovarian cancer itself. We'll go through medical history, family history, your sleep, your digestion, any allergies you have, how you're doing mentally. That's a really important picture that I feel like is often missed in the conventional realm. So we'll do a lot of counseling or referral out for counseling if we need it. And then we'll do a complete review of systems. So going through eyes, ears, nose, absolutely everything that makes you you. And then, yeah, I think Meredith, did you want to discuss kind of how you found naturopathic therapies or how you considered the approach here with it?
Yeah, I Yeah, as I say, what had happened is that, as I said, when I was diagnosed and when we knew that I was going to have to, you know, have chemotherapy and then a lot of it, surgery, as I said, my family did a lot of research. And eventually, actually, through a naturopathic center in Vancouver, where my sister lived, we were recommended to the clinic in Ottawa. And we already knew at that point about treatments such as, you know, vitamin C and mistletoe, which, you know, all of our research and what we knew, it would be beneficial. It would really help me get through chemo. And so that was one of the biggest, that was one of the biggest decisions that I think that I made early on, was to start doing that. And, you know, from my perspective, as I say, I knew right from the start, I could tell the difference. When I was having the IV of mistletoe and vitamin C after chemo, it did for me shorten the time period that I was down, and it also lessened the side effects, especially the fatigue and nausea, my appetite. And I knew that right away. So, and with some playing around in schedules of when the best time was to have it, we came up with, or I came up with, realizing that the best time to have it would be right after I had chemo, like the next day, as soon as I could have it. And then maybe in another 4 to 5 days to have a second one. And that just really helps kind of push me through. And the chemo regime I'm talking about, of course, is the first line chemo. That's the carboplatin and paclitaxel, which pretty much everybody with ovarian cancer, that's the one. And as we know, it's really hard on your body. So I found, as I say, that the mistletoe IV vitamin C just, as I say, made my life, or my quality of life, almost the same as it was if I wasn't having it.
Yeah, I think that's pretty much, Meredith was one of my only patients that I always rave about, where she would go kayaking after her chemotherapy. And I was like, I don't think I have any patients who have that much energy post chemotherapy to do something like that. So yeah, phenomenal results with her. Everything worked out really, really well for her. I'll share kind of what her I used her as a case study during the last time when I presented. So it's nice to have her here this time to
With hair,
to
I might
make
add,
me
well, too.
yeah. Yeah, so at the time she was 62 years old. She was diagnosed with ovarian cancer stage 4. She also had a lot of pleural effusion and ascites within the abdomen. She had a history of a right lung collapse, and the genetic testing was all negative for her. Like she mentioned, her initial treatment that we started with was 50 grams of IV vitamin C plus IV mistletoe type M at 500 milligrams. Typically, we would recommend this twice a week if possible for the duration of her therapy. But Meredith, she, with the travel, and there was a lot of different barriers, and we found a routine that worked well for her and that she felt well with. So we just complemented alongside with a bit more. We switched to a subcutaneous mistletoe that she could use at home if she wasn't going quite frequently for that IV mistletoe. And then we also added in some Coriolis theracumin, whey protein, a D3K2, some green tea extract, a fish oil, and an I3C that she had taken herself, and then some undas for some pleural drainage support. So we'll kind of get into what these are a bit later, but at the time her white blood cells and red blood cells remained stable. She had ascites and pleural effusion completely resolved. Her cancer antigen responded really, really well to all her conventional based therapies. She had a healthy appetite. She was kayaking and walking after each chemotherapy. So this is kind of what her standard case looked like when she originally presented to me. We've had some waxes and wanes and things come in and out during her whole entire diagnoses, but she's doing really well currently there. And we always get that kitty that comes and hangs out with us.
No matter what.
Yeah. With naturopathic medicine, so like Meredith was saying, she's one of the 80% of people who have sought out the use of natural and supportive therapies alongside their conventional treatment. So we as naturopathic doctors, our primary goal is to kind of reduce your side effects and help maintain your general quality of life. Prevent recurrence, obviously get you into remission, help optimize your conventional based care, and just kind of collaborate and advocate for you as patients with your conventional providers. So we're probably going to get a what will my oncologist think of this? And I have no problem. A lot of times I'm writing reports up to the oncologist, providing them with some of the background research or randomized controlled trials that support the safety that is included in these therapies that we're providing, or removing some treatment recommendations if the oncologist is providing a little bit more pushback, but really just consistently advocating for the patient to say, like, if you were in my shoes, you would be doing everything that you could be doing right now. So I run a very evidence-based practice. As we mentioned, I'm also a research assistant for the Patterson Institute, so we do a lot of research within our facility as well. But I just want to do that and make sure that what I'm prescribing to you is safe and effective and will actually work, and we're not just prescribing things for the fun of it. We don't want to cause more harm, and we don't want to cause more problems than solutions. So making sure we're really looking for an evidence-informed practitioner when you are seeking out naturopathic medicine in your cancer care. Another question we got very often last year too was, how do you find an ND who focuses on cancer care near you? So I included this link this year. This is the ONC-AMP. So this is the Association for Oncologists, not oncologists, but naturopathic doctors who focus in oncology. Up at the top here, it says find an ND. You're just gonna kind of click on that. And then within here, you can type in where you're located, and all of these wonderful naturopathic doctors that have a clinical focus in integrative oncology will pop up. A lot of great practitioners here that I'm already seeing that I would recommend for sure. So if you ever have a question about who you should be seeing, feel free to kind of reach out to me, and I'm happy to, or to Ovarian Cancer Canada, and I'm happy to guide you appropriately there. I lost my presentation now. Okay, I found it again. Let's see if it will. Okay, so this is now, when should a naturopathic doctor primarily see, or when should you as a patient primarily see a naturopathic doctor? And we can support you at any phase of your diagnosis. So as a preventative treatment approach, if you have a strong family history at the time of your diagnosis, or well, you're during your active treatment, or post-treatment if you're working on prevention of recurrence. We're having a lot of a hard time here, Meredith.
Technical difficulties. It's the bane of our existence.
Yeah. That's okay. Did you want to share anything while I pull it back up? I just lost it completely.
Yeah. Besides the vitamin C and mistletoe, there were some other things that we did that we thought were really important. Recently, several months ago, we knew that I couldn't anymore do the first-line chemo treatment, and so with that in mind, we had some blood tests done over in Europe at a lab that specializes in this kind of thing. And what they did is that they it's what's called a liquid biopsy, and with this liquid biopsy, they were able to give us a really good idea of what different chemotherapy lines might work. Agents, and that really helped inform my decision, because there was a decision to be made about what chemo groups or chemo regimes I was going to use for the second line. So that was really that was really helpful. The other thing that I found really important, and I can speak about it now or after you're finished your presentation, but it does have to do with mental health, which is a big part of anyone's journey with cancer. And it's a big part, I think, also of sort of complementary medicine as well.
Yeah, whenever you can share it now if you would like, Meredith. No
Yeah.
problem.
So so what we kind of found is, as I say, like having a diagnosis of stage 4 cancer or anything is scary, and it was definitely very devastating for me, you know, and my family. And yet I knew that, I say, that attitude and outlook play a really large role in how well a person does, you know, with any illness. But as I say, the first few months after I was diagnosed, I was not in a good place. And I saw my life as being over. And I saw that, you know, my future looked to me to be very grim. And, you know, that was it was just a very, very hard time, you know, as I'm sure everyone, you know, in that situation understands. But it was also really hard, you know, for my family as well, too, because they were really going through this with me. So eventually, you know, I did realize that I was going to need some help if I was going to, you know, get through this, not just physically, but emotionally, you know, mentally as well, too. And there are, as I say, in the complementary field and elsewhere in conventional, there's a lot of options. And so it really comes down to what's going to work for the individual. So for me, what was going to work for me. And that's the perspective that I was coming from. And again, throughout all of this, it was about my quality of life. So for me, right, you know, I ended up, I'd say, through various help, to learn to live my life in the present. You know, as I say, my reality is that, you know, I don't know 100% what the future is going to bring. No one does. What I do know, though, however, is that here, you know, in the present, you know, I'm alive, I'm feeling well, and I'm living well. And I am grateful, like incredibly grateful for so much, you know, especially, you know, as I think that my amazing family, you know, has loved and supported me in every possible way imaginable. And this is what I got out of, you know, the help that I sought. So it is very important that that we take into account during our, you know, any cancer treatment, that not just our body, you know, we've got our mind as well too, that we have to deal with as well, and that there is help available.
Yeah, absolutely. And I see it too whenever Meredith has her appointments with me, her sister Kathy, even though she's like all the way in BC, she's there supporting her alongside her on video during our visits. So it's definitely not just the patient that a cancer diagnosis affects, and it's a full family, friend, acquaintance, that anyone who kind of knows somebody, even if it's not ovarian cancer, right? So it definitely takes a big care team to take care of you, from professionals, but also from a family perspective as well.
Mm-hmm.
I know I want to leave a lot of time for questions, so I'm just going to quickly run through what a typical, depending on what you're doing as far as a treatment would go, what that would kind of look like. So this is sort of a pre and post surgical option that we would consider. Obviously, we don't want to interfere too much with your surgery with blood clotting, but we want to make sure that we're really focusing on tissue remodeling and immune status during this specific period of time, and also pain. So prior to surgery, generally we recommend some acupuncture and massage, and arnica is a common homeopathic that we'll use to support that kind of bruised feeling that we get through surgical procedures. Really increasing our protein supplementation, and then introducing generally a tissue remodeling support like ACEs plus zinc, which stands for vitamin A, C, E, selenium plus zinc, and then making sure we have appropriate vitamin D status and some probiotics added in there so that we're having good bowel movements and less risk for sepsis and infection with the surgical procedures. And then for mental emotional, just some guided meditation, and if possible, requesting a room exposed to some sunlight, but we know that sometimes is not always the case. With chemotherapy, depending on what one we're put on, like doxorubicin, we have a higher risk for cardiotoxicity. So we might interchange CoQ10 and L-carnitine on those off weeks where we're not exposed to doxorubicin if we have any rest time between rounds there, so that we avoid any interaction, because those are some antioxidants, so being respectful of that. Also doxorubicin, we see a lot of hand and foot syndrome, so sometimes we'll use acupuncture, hydrotherapy, B6. We use a product called Neurosupport, which also has some alpha lipoic acid in it, or lion's mane, which sometimes helps with that. Neutropenias, we're looking more at the mushroom-based factors here, so Coriolis, Gandoderma, Agaricus, again, vitamin D status, and then the mistletoe works really nicely here too to kind of keep those neutrophils at least at bay. Nausea, acupuncture, acupressure, ginger, fatigue, making sure we're getting adequate protein. Again, vitamin D status is up. We might talk about CoQ10 and L-carnitine again during here. And mistletoe works wonders as well for fatigue during chemotherapy. Alopecia, we have some agaricus studies. Sometimes I'll just recommend topical castor oil. I always do remind my patients that our hair loss is sometimes inevitable, but it will grow back and it will be totally different. And maybe you had straight hair and now you have curly hair, and everyone wants what they didn't have before, right? So sometimes it's a positive. And then the chemo or the foggy brain that we get, usually we're looking at a really high dose EPA fish oil, like omega-3 fatty acids to help with that, or maybe some nootropics, like again, your lion's mane or ginkgo if we can add it in. But yeah, just sticking to usually fish oils for that. And this is a little bit on IV vitamin C. So this is an intravenous treatment that Meredith was referring to previously. It offers a cytotoxic effect on the cancer cells, not your normal cells. So typically the higher concentrations of vitamin C are specific or selective to those cytotoxic cells that are in those those ovarian cancer cells there through the generation of hydrogen peroxide. So the vitamin C will enter the cell, it'll produce hydrogen peroxide, and then it usually gets metabolized into water in our normal cells. So it'll break down through an enzyme called G6PD. But our malignant cells, they don't have this enzyme. So we usually sometimes will see some apoptosis or cell death there, or it'll weaken the cell and denature it. So things like our paclitaxel and our carboplatin, they can work a little bit better and stronger on those cells. So it's a bit more of a synergistic agent. A lot of oncologists are a little bit hesitant with this one. We always try to provide a lot of clinical evidence to show that it doesn't decrease the efficacy of the chemotherapeutic agents when administered alongside vitamin C. In fact, in vitro and in vivo studies have repeatedly demonstrated that the vitamin C has some additive therapeutic effects with various chemotherapy agents, so the bleomycin, cisplatin, cyclophosphamide, doxorubicin, and we always are respectful of your chemotherapy, so we usually administer it within 5 half-lives away from your chemotherapy to completely avoid any potential interaction, and the half-life of IV vitamin C is 2 hours, so just respectful of that. And yeah, we always have we have a huge IV vitamin C study coming into our clinic that's just getting the final details of that. It's not with ovarian cancer, it's with lung cancer, but it'll be nice to see how we use alongside the IV vitamin C with some conventional based therapies there and what kind of comes out of that in a big randomized trial. And then this is the mistletoe. So another very commonly used one. There's 3 different types: apple, oak, pine, or sorry, there's more than 3 different types. There's apple, oak, pine, spruce, and elm. There's 2 different components, so the viscal toxins and the lectins. One is more so working on the cytotoxicity, where the other one is inhibiting the growth of the cancer cells there and has a bit more of an immunostimulating effect. So this I usually use more so for your improvements in your quality of life, your fatigue, your neutropenias, your bone pain. It makes their patients feel generally a little bit more well, able to go about their everyday routine with ease, and they just generally feel a bit more healthier on this. And like I was mentioning earlier, you can do it subcutaneously as well as intravenously too. And then I wanted to touch base on some palliative care options too, because sometimes we have patients come in and they don't really have any conventional based treatment options or approaches anymore available to them, or we've been doing conventional based therapies and we've exhausted them all and we've entered more of a palliative care. What's important here is that we have a really big comprehensive care team during this period of time. So we definitely need a nurse practitioner, a palliative care nurse as well, a naturopathic doctor like myself, or someone else who's used to working in these scenarios. And then I always say it's important to have a psychotherapist and a grief counselor around this time too. Big things that we'll add in here instead of your conventional based prescription would be like your IV vitamin C, like I talked about, your mistletoe, subcutaneous or IV. Artesunate is another one that we might include. And then off-label prescriptions that usually my nurse practitioners will discuss whether they are worthwhile adding in or they're good, my patients are a good candidate for. So CBD, THC, sometimes we use this for sleep and pain, and then low dose naltrexone is an anti-inflammatory. Metformin, working on your insulin levels there and its effect on cancers, your statins. ASA is an aspirin, and then alpha lipoic acid or DCA. These are just other kind of palliative options that we've used in the past with patients that might have some benefit there. And then that's it from me. So this is just where you can find me if you wanted to book, and I included it there for you. There's lots of, like I said, there's lots of different practitioners across across Canada and the United States as well that have experience working in naturopathic care. But yeah, Meredith, do you have anything else you wanted to add in there?
Just a very quick, short, final thought, about my life, that because I find it's important, at least for me, to let people know that, though at times it does feel like a, full-time job, cancer is only a part of my life. And that's what I've really tried to focus on. It's not my whole life. I make sure that I have other things to focus on, like my job, because I do still work a bit, and doing fun things with my family and friends, so that when I do go down the rabbit hole that everyone goes down, and I do too, of worry and fear, especially when, something out of the blue, happens, like my recent, bowel obstruction. I have then at that point many reasons, and many people to help me climb out, and that's a really important thought that I'd like to get out there, because there, as I say, it's a long journey, and it's a rough journey at times, but it also can be really happy, and being able to grab that, I think, and hold on to some of those moments is really important.
Exactly. I think that's really important to add in.
Well,
I think
yeah, we have a ton
yeah.
of questions, Dr. Keates, as you
Yeah.
knew. I want to thank you both for that. Some great information there. Thank you for sharing, Meredith, for sharing your story. I really appreciate you speaking about the benefits of complementary therapies and also how important it is to work so closely with your entire healthcare team and really make sure everybody's in the loop on everything. So thank you for that. So I'm going to get to the questions because, like I mentioned, we do have a lot. The first one I'm going to ask refers back a little bit to the session we just had about menopause. And it is Dr. Keates. Can you speak to managing hot flashes for ovarian cancer survivors who's gone into surgical menopause, and what kind of therapies might you recommend for that?
Yeah, exactly. So we'll start primarily with just some lifestyle changes that you can do using like sage, if we're able to, if we're not on any hormone replacement therapies. Usually in breast cancer we are, so that's a bit of a caution there. But sage is really cooling. Or we'll make sure the room or bedroom we're sleeping in is really, really cold at night, if possible, especially in the winter. That's a bit easier. We might add in things like a rhubarb. We have a product called Meno-Ease, so we're looking at things that like compounded supplements that treat more so menopausal hot flashes, but similar process here with your more hot flashes from your ovarian cancer being induced into a menopause. The other would be magnesium. We commonly dose magnesium pretty high when it comes to hot flashes. We use magnesium oxide, so that's another option too. But yeah, there's a couple options there for treating hot flashes. It all really depends what you're already taking though. So we always want to make sure that anything that you're on isn't going to interact with what's being prescribed or recommended.
Okay, thank you. A lot of questions about neuropathy. So any suggestions or thoughts on that? We probably have 6 or 8 questions on neuropathy and how do you help manage that?
Yeah, a couple cool trials that have come out. One that we most recently talked about in a kind of like a CE continuing education course was chewing ice chips while you're getting your actual treatment. So that's a kind of a neat one that's easy to do, but showed to be clinically effective. So that was one. A lot of my patients too, they'll wear copper gloves or some sort of a compression glove or stocking with a bit of copper in it to apply some pressure to the distal extremities so that we're creating circulation within that during any time of the day or during your actual infusion itself. Hydrotherapy itself, so hot and cold, alternating back and forth, are good options just to get circulation to your hands and then clearing it out. Like I said previously, we have some research on like alpha lipoic acids or lion's mane or B12, melatonin. There is a study going on in the US with CBD and THC, so I'm curious to see what kind of comes out with that, with more topical use, like a cream. So yeah, neuropathy is a really tricky one to treat. There's not a lot of things that have really strong evidence to support a massive reduction in your pain scores or in your neuropathy scores, but we do play around with a few things that might work. And again, just making sure that you're with somebody who knows what you're on currently, because things like alpha lipoic acid, when we're introducing more antioxidants, those can cause more harm than good.
Okay. On that too, another comment here. Any thoughts on laser therapy as being effective for managing neuropathy?
I haven't used laser on neuropathy. I'm curious, it might actually work. I have used it a lot on oral mucositis and seen a lot of benefit with that. And like ulcerations within the teeth and gum lines from head and neck cancers where they do a lot of radiation, so really, really bad oral mucositis, and seen a lot of benefit with that. So I do know it does promote definitely a lot of nerve regeneration, but I'm not sure. I've never prescribed it for peripheral neuropathy, so I wouldn't be able to comment too much on that.
Thank you. Meredith, I have one for you here. There was a question wondering if you did any of your chemo treatments without having intravenous, so you knew the difference.
Yes, yes, I did. And usually by accident. Actually, my first chemo, I only had vitamin C. There was no mistletoe, and after that, there were times because of scheduling and problems where there was a couple of times where I wasn't able to have it, or I wasn't able to have it until later on, until after really I'd already gone through what I call those 4 or 5 down days where you just feel really bad. And yeah, so that's how I started to know when to have it as well too, and to know the difference. Absolutely. Yeah, I felt like I was my own clinical trial.
Thank you. Now, Dr. Keates, we also have a few questions about coverage for naturopathic doctors. So, and this, I understand, may vary. We're now on a national platform tonight, so I do understand that this may differ from province to province, but can you speak to any coverage by provincial insurance or other workplace insurance companies? Or second part of that question, do you know of any other ways for assistance in paying for these types of treatments?
Yeah, absolutely. So across Canada, from what I know, naturopathic medicine is privatized. So no provincial healthcare coverage will provide you any funding for it. If you do have privatized insurance, then you get a specific allotted amount. Usually when you do have oncology care, though, you surpass that amount quite quickly, because these treatments that you're getting, if it's IV therapies and things like that, it will kind of run through that amount quite quickly. A lot of clinics, they do offer subsidy options. So ours is one of those too. So if you have a specific, you make a specific amount per year, you're on ODSP or anything like that, we do take that into consideration and can submit an application. And I know a lot of clinics do that as well, to kind of give you a specific percentage off of your treatment plan to make it more accessible. But yeah, it is unfortunately not government funded, but hopefully, I'm hopeful, maybe not in my lifetime, but hopefully it will be included one day.
Thank you. I think we have time for 2 more questions. So one question here is, I'm on maintenance therapy, which is causing insomnia, and I can't take melatonin. Any suggestions?
It's a good question. It's hard to answer because I don't know therapy wise what you're really on. If it's like you're on maintenance therapy, so I don't know if you're taking anything at all. But usually we would start with like sleep hygiene, so making sure we're following proper sleep hygiene rules. Other than that, we would look into what exactly is it a hard time getting to sleep, staying asleep? Is it multiple nighttime wakenings? Is it the conversion problem? Like, is this a 5-HTP where we're converting from melatonin to serotonin too quickly? We need to provide you some serotonin. Is it as easy as just adding in some magnesium? Sometimes that helps. Other than that, maybe lavender, chamomile before bed at night, or some other ones, like if we're not on anything, we might consider things like valerian or skullcap, more sedating herbs like that, passiflora, passion flower. That might also help you a bit more sedating herbal process instead of nutraceutical.
Thank you. And I mean, I do understand too, kind of an individual question, so you need to know more about the situation.
Yeah.
We also are having, for whoever asked that question, tomorrow night in the symposium, we have a full session on sleep, getting to sleep, staying asleep during treatment. So we have an entire session dedicated to that. So make sure to tune in. Finally, Dr. Keates, just before I let you go here, we did have some requests for references for some of those studies so that people can read up a little bit more. If you could provide those to me, that would be great, and we can get those out there. That would be amazing.
Absolutely. Yeah, I can forward you the PowerPoint presentations. They're all in there in the like little note section on the bottom of the slides.
Perfect. So I just want to thank you. Sorry, we didn't quite get to all of the questions, but again, a rapid fire questions. So obviously subject matter that everyone is very interested about. Thank you both so much for sharing with us tonight. We truly appreciate you taking time out of your nights to spend with us. So thank you.